I was diagnosed with type 1 diabetes when I was just 3.5 years old. I see an endocrinologist and an ophthalmologist every 3 months. I've been in the ER about 6 times because when you get sick, your diabetes becomes much more difficult to manage. I had paid approximately $10,000 out of pocket, and that's with good insurance and a decent paycheck. I'm not sure how many other diabetics in the world make it work. It's just really difficult.
Right now, we have a healthcare system that is not designed to provide quality care to all people in a cost-effective way. Let us be frank. We have a health system designed to make enormous profits for insurance companies and drug companies.
If I end up in the ER, I'm obviously going to get that bill. It's all of the copays around any medical provider I'm seeing because of my diabetes. I get fairly regularly treatments on my left eye. Going through insurance helps, but essentially I was still paying close to $2,000 for an injection in my eye. It depends on where my means are at each month, each year. I try to pay as many bills off or make larger payments when I can, but sometimes I'm literally paying the minimum amount that I can. The act within the Affordable Care Act to protect people with pre-existing conditions was a huge win for people like me who live with diabetes, as well as the array of other sorts of illnesses. It's like a big sigh of relief, essentially, knowing that this policy understands the difficulties and the barriers of living with such a serious disease. If I didn't have insurance or those protections, that I would be paying just short of $300 for one vial. So I'd essentially be paying $600 a month just for the insulin. We are just trying to literally live, and some of these steps that are taken make that incredibly difficult.
Nobody believes that we should be throwing tens of millions of people off of health insurance. What people believe is that all of us should be guaranteed health care.
I would not choose to live this way, but I had no choice. Like, my pancreas just stopped producing insulin when I was 3 years old. It's something I have, something that happened to me, and I should be able to access the medical health services that I need to survive.